we provide a custom tailored solution for your business, which is not a canned system or a software that we are actually offering you. Because our system has that capability. We know about
Yeah.
each and every state, their Medicaid and all that. A lot of startups do actually come to us, and when they actually sign up with us, we actually help them guide through on how to grow. We have got 150 plus years of collective experience between all the employees. So
I
we
believe it.
actually do bring
Yeah.
the value.
Pallav, thank you so much for joining today's podcast. And for the audience listening, we have Pallav Saxena, CEO and founder of myEZcare, joining us today. Pallav, thanks so much for making some time.
Yeah, thank you for having me, Bert. I really
Yeah,
appreciate it.
absolutely. So, Pallav, I want to jump right in. You've spent like most of your career at the intersection of healthcare and technology. Can you walk us through your journey and what led you to found myEZcare in 2017?
Sure. That's a pretty long journey, though. So I've been in data for over a little over 20 years. And I started my career as a DBA and knee deep in tables and queries. And that's
Hmm.
where I found out that I'm really good at turning numbers into stories. And fast forward, Affordable Care Act came in, the bill was signed and given effect. So I helped a lot of hospital systems to spin up ACOs, tracking population health metrics and running a population health management programs actually. And that's where my light bulb went on. I'm like, whoa, this healthcare data is really amazing. And it can tell a lot more if it is done right. And then I actually got an opportunity to actually get into the home and community-based providers and services. And that's where I saw that they are juggling with five different systems just to stay compliant and is still drowning in paperwork. And that disconnect kept them from scaling or improving the quality of care. And all they were focused on, how can I actually get that bare minimum revenue and then keep the lights on? And that's not the care that they were focused on or they started with, but that was how it was. And then anything that was available, they were the conventional EHR systems that actually work with the traditional practices where you get the progress notes, you get all kind of different encounters and all that stuff, which doesn't align with their processes at all. So I saw a huge gap there, and I'm like, that's a huge gap. So let me see what I
Hmm.
can, if I can actually take the advantage of that and bridge that gap and build up something like that with my past knowledge of data, my past knowledge of technology, and my in-depth knowledge about the healthcare that is there. And that's where the birth of myEZcare happened. And so I started myEZcare with a vision to create an ecosystem, not a solution, not a software, but an ecosystem with a lot of services that can pull in all different kind of aspects of an operation into a single platform with a single sign-on and help in making a single workflow, cut overheads, and let agencies grow without adding more stuff just to push papers. So
Hmm.
that's the story of that actually, and I see that we have made a great progress in that, and the vision is basically there, and we have been on target with that so far.
Yeah, right on. Well said. I mean, it's clear you started your career as a data expert and you started to dig into like the community and healthcare side of the equation and saw that, hey, data is not only complex and beautiful, like you called it, but there's opportunity here. There's gaps that can be addressed. And,
Yes.
something for the listeners that stood out to me from our previous conversations, Paula, was that you have bootstrapped the company from the ground up and own every piece of software and code. Is that right?
Yes, and that's very interesting actually. So when I saw this gap and I had a plan of actually starting off a product like this, I didn't want the investors to come in and actually dictate the product growth based on how soon can they make an exit with percentage actually. I wanted to actually have it done really for the community, and that's what my focus was. So we do not
Hmm.
cut corners on that and not influenced by who is going to get the return on investment and when are they going to make an exit. So
Right.
I bootstrapped the company, and I actually had a vision, and I waited a very long time, saved up the money for many years, and then I used that to start off the company. And I started out with a very different philosophy of how people do it in a very conventional way, like, okay, buy these subscriptions, let's move into the market, get investors, put the seed money, and then jump into it, increase the valuation, and move out. And our vision, one philosophy was entirely different.
Hmm.
We came here for the long game, and that's what I did actually. We built our own infrastructure with Bootstrapped, and then we actually built our own systems, softwares, everything in house. And then all the different other supporting systems that are required are also in house. We do a least amount of subscriptions in our ecosystem of our own operations to keep the capex down, and
Hmm.
that actually helped us in translating the cost back to our customers. Giving you a simple example, during COVID, I actually have my clients, when they were struggling, deferred their payments for 6 months, and still my company was surviving, cash flushed with cash, and no layoffs in our company. Actually, we grew at that time. And that was
Hmm.
basically because of this philosophy. OPEX is really low, and that actually helps to do that.
Yeah, well said. I mean, that's clearly a differentiator for you is being able to own all this software and code. And I'm sure your clients and partners like also benefit from that, right? And I know we may get to this later in the podcast. You may be able to preview some of that with us. But before
Oh,
we
yeah.
get there, I want to talk a little bit about the gaps that you mentioned earlier that you started to see in the home health, community health, and senior care markets that you called it like traditional systems weren't solving. I think you said like you saw up to like 5+ different systems in a single home care agency. What were some of those gaps and how did that influence your vision for what you built at myEZcare?
Yeah. And see, the truth is, most care doesn't happen in hospitals. They are taken care of that. I mean, there definitely a care happen, but a long-term care that actually happens, it happens in the homes, in the senior centers, in elderly care, and with a caregiver who actually has a personal connection, and he is taking care on a daily basis and actually help the patient heal over the period of time, right? And yet the technology, it wasn't built for them. Now, there are a lot of systems that would not care for the DDD, or the divisional disability programs, or some kind of an HBCS program for family together. Those do not, their operations do not align with the conventional systems. They need a lot more different things. And that's where I see the other systems are too complicated, too fragmented, and most of the time, if the providers have to use this kind of a system, they have to change their processes to align to the software, and that is not correct, because that actually
Hmm.
adds a huge learning curve, and then they have to actually change their processes, and it becomes an overhead for them also. And that's why I started myEZcare, not to build another EHR. Definitely, EHR is a part of it, but not to build that, but to build a platform that understands this world, that supports the caregivers in the field, that brings everything in one place, from compliance, billing to the real time insights. Because when you empower the people delivering the care, you transform the system. That's the kind of a change I knew I had to be part of. So we built up a system which is basically eliminate the siloed, disjointed other subscriptions that are needed, all built into one as a single sign-ons. Like, just one sign-on, you get one platform, you can do billing there, you can do scheduling, you can do the progress notes. We have got digital document library. Literally, you can have any form customized and be digitized, available digitized in any language, over 150 languages, and can be used anywhere. And you can literally carry the whole office documentation in a cell phone and go anywhere in the world and use it. So that's the
Very
power
cool.
that I actually gave to them. And now on top of it, we are adding AI into it, that is actually reducing their repetitive work tasks and workloads, and automating a lot of different kind of other workflows for them, so that they can only focus on improving the quality of care, reduce their overheads as well, and grow.
Yeah. It sounds like it's really kind of like an all encompassing system. It's not your another EHR in the market, but you guys have really understood the different like needs components of like let's just pick like a home care agency, like all the things that they need to do on the front end, the back end, like routing their caregivers, like all of that is you guys have built into a single system that can be customized, speaking to your as a testament to your philosophy of your business of like we own every piece of software and code. You guys are able to build that too for clients, which is
Yes.
pretty
And
pretty impressive.
Yeah, and one interesting point here is basically we are very different from the other companies. The philosophy of the company is very different. Our customers are the first, actually. So every customer of ours, every client of ours that actually takes our system, they automatically get into our customer advisory board or CAB. And when they get onto
Mhm.
our CAB, they actually can put in the feature request, they can actually put in the change request. And if when we evaluate those changes, we literally bump them up on our roadmap to release that as early as like what next month release. So it's not like there's a system that is baked up. This is all you have to do, and you can use it. There's nothing else we can do about it. Or we never give the visibility to our customers, like telling them what's going to happen, or are we going to create that feature that are in need of. We are always transparent and let them know right away, hey, we are going to do that, and we are so customer focused on that side of it. None of our customers has to wait on a phone line saying tier 1 call, tier 2 call, or some kind of an email communication only. We jump on a call, we
Yeah.
get on with our clients and actually help them out every time.
I love that. You have, like you called it, this CAB, customer advisory board, where you can customers can submit change requests, and then you guys
Yeah,
factor that into your roadmap. You're able to
yeah.
bump things up on
And
the roadmap based on the
yeah,
roadmap you get,
and
which is pretty
if we are
impressive.
bringing in a major change in our system or anything, this customer advisory board, we take them into account and like actually ask them the question, hey, we are going to bring this change. What do you think of it? And we take their advices on that as well. See,
Right.
the best advice that you can get is basically the clients in the business actually, and we actually follow our clients.
Yeah. Yeah. Well said. And I want to learn a little bit more about the types of customers and clients that you guys support, because from what I understand, you guys support a range of different care settings beyond just home health. Also includes behavioral therapy, foster
Yeah.
care networks, DDD, HVCS. Like, how does your system that you've built streamline operations across like such diverse like care settings?
Well, one of the best things that we built our system with a vision that we want to cater to all of these industries and business service lines, and how to actually make sure that we can actually do and cater to these. On the early days, my team and myself have noticed that not one service line is identical to the other service line, and even in the same service line, the two states can have a different operations also and the different processes. And I said,
Mm,
how can we actually make that versatile enough to actually cater to all these requirements, and how would we do it? So we used an onion architecture, and I don't want to be geeky on that, but we used the onion architecture, which is really modular and layer by layer, and everything is basically a microservice that actually works behind the scene. So today a client can actually, from say a client from Maryland and a client from Arizona, they have both in home healthcare, and they have a different requirement on how the state is asking them to do. We can cater to both of our clients
mm.
because of being modular, and give them the same software with a different version in the same subscription model as well. So, and even somebody says, you know what, the older version was great, we have to upgrade. Our clients can actually stay back with our previous version who wants to, and then other one can move on to the 1.2 version. It is that modular that you can do. Now, so when talking about the service line, there are a ton of service line that we have to cater to. Just in home health care, there's a home health care, like literally, and then there's a home health care, like where more clinical and non-clinical distinction, their separation happens. So there, those two cares are very different.
Mhm.
And then when the caregiver actually goes out, a simple home care is basically doing like activities of daily living and bunch of different, like preparing meal and all that. Not that intensive. They can get a checklist of their task, and they say check, 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 and done. But when it goes to the clinical, they need to add the notes, they need to add the forms, they need to actually put more details on the different activities that they automatically, the system identifies what kind of a care is it going to be, and the system actually provides them the different task entry system, different ways of doing the task entries that cater to the different sides of it. Now we
Yeah.
cater
Well
to
said.
yeah, so now we cater to home health care agencies, behavioral health programs, adult daycare, assisted living centers, foster care, and then development disabilities division or DDD providers as well. On top of it, we have started the RPM and CCM programs that are going into the connecting more to the physicians and clinics as well, so that preventative health can very well be provided.
Yeah. I mean,
Yeah.
it's clear you guys are covering a wide range of different service lines, like you called them. And it's a good point you made around there's clinical and non clinical home care. You know, a lot of people don't know that distinction that aren't in that space, and that's important because those are each different in their set of needs. And I want to ask you, how did you guys get into the DDD space, like the developmental disability space? How did you guys enter that space, and what are you doing there? Do you mind filling us in on some of that?
Sure, sure, absolutely. So we walked into the DDD space when one of our clients actually came up and says, "We are with a very established company and they are not catering to these certain requirements, and we are constantly struggling with it. New guidelines are coming up and they are not catching up on that. I'm really worried that my revenue might be actually penalized on that." So, a lot of your requirements do match up, but there are a lot of things that you need to do. Would you like to? Like, as usual, we want to serve. And then I heard the story of my client. Her own kid is actually going through the therapies also, and she has a bunch of problems, and she was also dealing with that. I was able to understand like what is driving her to run an agency like that, and I'm like, okay, fine, I will work with you, and I will definitely build up and do that. Now, building up an additional features or the things that they need to cater was a piece of cake for us. Our technology engineering team, they can literally do anything. And with the AI into our system, we do a lot of bigger stuff in a very short period of time. So that was not the
Hmm.
problem. The problem was like, what is the business? What is the need? How to actually cater to that, and how it will get into the foundation of our system. Once we understood that, we started moving into that direction. And definitely, our subject matter experts said, okay, fine, this is a new service line we're going to take. Okay, let's study on it. And then they took a deep dive on it and understood what the business looks like, what happens with that, interviewed a lot of other businesses on that. And then once we came up with that, and then we said, okay, fine, we are going to get into the DDD business now. And that's how we built up the system. Now, that system has a lot of different features like goal tracking, goal management. Now, goal management assigned to the task. Like a task, a kid is asked, the task is to tie the shoelace, and that can actually be
Hmm.
associated to the motor skills or something like that. Now, goal tracking will be, the goal is basically to have the motor skills. They will be attached to the task, and every time the caregiver does it, it will say, "Yeah, he was able to do it," "Not really able to do that," or "Yes, he did it." And then slowly they can actually track and actually improve that goal, and
Hmm.
automatically the goal progress is tracked. Now, once the goal progress is tracked, every single time as the activities are going on, the AI actually, based on the progress, generate the notes on it on every visit that is happening. And then finally, a report gets collected and then it's sent out to the Medicaid saying, hey, this is the goal. The kid has actually mastered this goal now. Or sometimes it's like goal,
Hmm.
they just refuse to do it, then the goal is retired. The kid is refusing to do that. Let's change the approach. And this goes back to the care plan, the case managers who actually review the care plan, they change it, and then they try to do another goal. That's where also the AI plays a very important role. Based on the previous goals, mastered and retired, they will actually, the AI would actually suggest what are the other ways that, or the other goals that can be put in place for the improvement of the health of the patient. And then those goals will go back to the system, and then the same activity starts. And that's how we are using AI in every single use case in our system.
Very fascinating. Yeah, I appreciate you filling us in on really how you were able to adapt to the needs of this DDD space and
Yeah.
build them something that met their requirements, including things like goal management, sending reports to Medicaid, getting data back to the case managers. So very interesting. I know you brought up AI a few times. I want to ask you about that. You've, from what I've learned, made some key investments in AI for your business, from things like conversational voice tools to predictive alert systems. Can you share how these like AI innovations are helping care teams and their leadership? Maybe a couple examples of where you've implemented AI and what it's led to?
Yeah, absolutely. I mean, AI is my new favorite. So I,
It's everyone's new favorite.
everyone's
Yeah.
I love
Yeah.
AI so much. As like basically, it has made everybody's life very simple. And then a lot of things that we want to do, and with AI, it has been more simplified. The power of AI is like, how are you going to use it? And we have got ton of use cases on AI side of it. Let me compile myself to think about like how. So in our development in an engineering team, we use the AI heavily for where our let me give a little bit of a context first thing. Okay, how we operate is, as I told you, bootstrapped and everything gets on-prem, right? And that's the same philosophy that we
Mhm.
have used with the AI also. And this year we made a very huge investment AI side of it by purchasing a lot of GPUs and a lot of horsepower for running the AI systems. So what we did is basically we built our own AI platform internally, and that is actually used for all the all the systems. So the our AI system actually, because it's on-prem, I don't have to worry about the PHI, and we feed in all our database data into that in the textual format. And once it is actually ingested into the AI, the models do learn about each and every patient in our system on what's going on with that actually. And on top of it, we actually put the meta based reporting, which actually drives like a chat based conversation. So you can say, how is my John Doe doing in the past 1 month? Or what is the revenue of Mary in the past 3 months? Do you know where I fall behind, or what is my aging on a certain payer? What are my CPT codes that are actually paying me the most, and what are my CP codes that are paying me the least? Right? Lot of different kind of questions, or any kind of questions that can actually be, they are all into that. Now what we did is basically we built our own customized MCP servers and the agents on it with the automation system. Now these agents actually work on behalf based on the AI instructions, either through the cron jobs or through the manual instructions or on the events actually. So for example, a manual instruction can be sent out through an omni-channel saying, hey, I want to have this schedule change, or somebody puts in a note that a patient is going on a vacation for 10 days, right? What does that
Mhm.
mean? It means that the caregiver needs to be notified that there will be no schedule for next 10 days. The patient needs to be, and then the patient's scheduler needs to be informed about saying that there is a block on for the 10 days, no care is going to be provided. He's on vacation, right? So once they actually put that note, AI can take it, it will run an event, and it will actually block that calendar and then put the note on every single one of those days that he's on vacation, so no service provided. Later an audit happens, that is an evidence, caregiver is actually informed, and his calendar is freed up. He starts showing the free hours, and then suggestion actually goes to the planner saying, hey, these many days this caregiver is free. If you have any additional occupancy requirements, just fill it in. The other AI agents that actually work behind the scenes, they actually do a lot more on looking at the prescriptions and saying, this person took a 30-day refill and no new prescription order has come in. And it's been almost 45 days. That means he's not taking the medication right. So our chronic care management team is actually getting informed and say, hey, you got to take care of that.
Mhm.
Right? A lot of other RPM and AI based use cases are there that we actually take into account, and we use that a lot of times. So one classic example is, do you know 30 to 40% of emergency admissions that happen, or the problems happen with the senior, is basically due to the fall. And early stage, if you do not do the fall detection, there are casualties also. So one of the things that we do is basically we have got our own remote monitoring system that can be in the house and that can track without any cameras. It's all on the infrared and the motions and all that stuff. So if a client or the patient living alone goes to the bathroom every day at 10 p.m., comes out in 5 p.m., 5 minutes, and then he goes to bed, sleep. That's the trend, right? One fine day he goes in and he doesn't come out for 20 minutes. Our system is going to raise an alert on that immediately based on the trend analysis. I say, this is an anomaly. Somebody has to take care of it. Now, again, there is a cost associated to it, right? So, what our conversational AI does it actually makes a call to catch on their well being if they can. If they do not, then they actually send a message to the caregiver or whoever is responsible to dispatch somebody to actually look at that. This major
Right.
implementation is basically in South Africa, where there are big villages. They call it the big villages, and a lot of European population retire in that part of the South Africa actually, and that's where this
Mm.
agency is taking a huge advantage of that. And they said their overhead up just on the caregivers being there or all this kind of stuff happening has gotten down by 40 to 60% now. So that's a major impact that we
Yeah.
made with that.
Yeah. No, I mean, to summarize all the great stuff you said, I mean, my read on it is you've essentially built these little chat GPT like models. Like, I know it's your own, it's built on your own on premise for each of your clients and customers that's trained on their patients and their business, and then you have those connected MCP servers with agents on top of it, that can do more advanced like prompting, I imagine.
Yeah.
One of the examples you just gave is with remote monitoring, which is super fascinating because I think when people think about remote monitoring, they think devices, like remotely monitoring patients through devices. But you can also design a system that can detect, hey, mom or dad had a fall in the hallway, time to alert the caregiver, and then that's able to escalate up the chain. Really interesting. And I do want to ask you a little bit more about this like RPM and chronic care management space. How are you guys like specifically helping populations like Medicaid and even like Medicare populations of all these seniors that are going to be retiring? Like does your system and the remote monitoring systems and chronic care management systems you built address those populations?
Yes, yes, yes. So we have got like this kind of blood pressure machines. We got weight scale. We got a bunch of other devices. What we do is basically these are basically the patients are actually enrolled into the RPM program, and if we see there are two or more chronic conditions that the patient is actually having, then they actually get enrolled into the CCM or chronic care management. We have our own in-house medical assistant who actually work with the clinics and physicians, and they all get the daily monitoring reports from all these devices. If there is an arrhythmic reading or there is a elevated readings on any one of these, the flag alerts actually go up, and that actually informs the MAs to actually inform the physician and take the due action on it. Not only that, other alerts and other alerts that are there related to the medications and a lot of other things, they actually work seamlessly with the patient to improve their health by proactively following up with the patient on what's going on and how can that be taken care of. So that's a big program that we
Yeah.
are running, and which is basically helps quite a bit with a lot of different patients. I mean, if you do not check on the blood pressure, or if it's slowly elevating, or it's not getting out of it, it's not in control. And between the last visit and the next visit, if there is a gap and there is nothing, something can happen, and that can very well be tackled with this in on time.
Yeah. And it's a testament to what you said earlier about building an ecosystem with a lot of services, right? Because like RPM, CCM, these are programs that have been around for a while, but I think where a lot of providers like, struggle is, okay, I know this program, it needs to be ran and what the outcomes will get me, but like, how does this connect back to the core systems I use? Like, how do I make it easy to ingest, like digest the data, then report it out, right? Like, that's where I think the struggle is. And so again, it's a testament to what you're building, where it's like you have all these foundational things that you need if we pick a home care agency, you guys have checked the box on a lot of those, but it's like, hey, I'm a home care agency or a home health group provider, and I want to go grow my RPM or CCM program, and you guys are able to support them with that, which I think it again speaks to your mission and philosophy.
Yeah, and I listen to my customers a lot. I meet them. I fly out and I meet them. We are not just a face behind the internet or hiding behind something like that. The whole team actually goes out to clients and talk to them in person. I went to one of my clients, was a case management, and then we have the solution for the case management as well. So case management said, yeah, our volunteers and the nurses do actually go out for the assessments, 3 month assessments, 6 months assessments, and all that. And then they get 7 days to actually submit the assessment report that can be get sent out to the Medicaid. Then only they get paid. Otherwise, they don't. Most of the time, what happens is these nurses are basically working full time in some kind of an hospital or something like that, and they do as a moonlighting these kind working for the case management. So they did the assessment, they have the documentation done, they did not formalize it, they sit on it, 7 days goes by, case management loses the money. And I heard the client and I said,
Mm.
okay, we can do something about it. And what we did is basically, we said, we have the digital form digitization service. We are going to give you a digital fillable forms that these nurses are going to use. So, and we attach those
Mm.
forms to the task and said, you cannot complete the task and cannot complete your timesheet till you actually finish that form. Now, if you do not do that, because normally what they used to do was like finish their timesheet and say, okay, fine, my timesheet is there, I need to be paid. Well, the case management lost the money on that, right? So that's
Yep.
where I actually put in a system where all these volunteers or nurses who are going out, Just fill out the documentation right then and there, submit it out, and complete your task. Once that is done, your task is complete, your timesheet complete, everybody's happy.
Right.
Simple
Right.
things. We
Yeah.
listen to our customers all the time.
Yeah, it's another great example, another really good use case of how a client or customer came to you and you're like, hey, we have this form digitization process, and like we can help you with that. But I want to ask you, Paul, like I know a lot of what you built for these systems that you built for clients and even like the AI that you built on top of it may be sensitive to share with the open market. It's their data. I get that. But are you able to show us anything that you've even built internally, maybe for like internal collaboration or for the viewers and like listeners that you can like show and tell us, hey, look at this is how something we built in house as a testament to like, hey, we own every piece of software and code. Do you mind sharing that with us? Something
Oh
you built
yeah,
in house?
absolutely, absolutely.
Yeah.
Yeah, I'm gonna give you a walk into my office. My office is really interesting. We have an
Okay.
office, really a good office, and everybody's working there. Even though it's virtual, nobody feels like it's virtual, and it's all on-prem, on-house that we have got. So let me share my screen and show you.
Okay.
Okay, just give me a second. Let me share my screen and show you that. Okay, here's our office. So as you can see,
Oh, look
this
at
is
that.
this is me, and anytime everybody is sitting in their office and room, the beauty of this is basically this is completely customized for our operations. If I go to anybody, like anybody's cubicle that you go, you can see them face to face, you can talk to them face to face, right? That's exactly what you can do. You can share screens, you can share documents, you can draw for each other, and you can collaborate as much. And then there are dedicated meeting rooms as well. Two guys are in the meeting, few of them are working here. So, for example, I'm
Oh,
going to go, let's see what Steve is up to. This is Steve, our sales director, and he must be doing something very serious.
we can't actually hear him, but it's amazing that you're able to go to this virtual office and prompt one of your coworkers.
So that's how.
Fascinating. I love it. You built
So
like
this
truly like
is,
a virtual office.
you can actually have the chatter going on as well. So everybody can chat here. There's a chatter here where you can actually enter messages, chat, announce. And then we also got a nice town hall that happens. The best part with this remote virtual or working environment, we are not limited to one place where we have to hire people from. We hire people from all over the world, wherever we can actually source the best talent from. That's one. And the second thing is our shop runs 24/7. Not 24/7, 24/5, but it does run 24 hours.
No, this is fascinating. I appreciate you giving us an inside look at your virtual office and how it works. And
Yeah.
it's a clear testament to we own every piece of software and code. I mean, that's case
Yeah,
in point
and
right
everything
there.
is we got our own data centers so that we can have the highest amount of security and everything. We have our own servers, whatever we want. We lease a space. We have got two data centers, one for the DR, one for the primary, and we manage that with our team of network engineers to manage that. Oh, I just walked into the conference room actually. Oh, not the conference room, the town hall room actually. Everybody here can actually hear us
Town
and
hall
talk.
room.
So yeah, a lot of those kind of things. We have got our own portal. We have got on our ERP. So we are very well sufficient on managing all these operations like a complete. And one of the best part is because these all the systems are on-prem, we have a great opportunity
Mm.
to actually use the AI agent. So literally, there is a human organization chart, and we do have an AI agent organization chart also. And the whole
Wow.
organization chart, they operate, and these agents have their jobs to do, and they all do their job on a daily basis. So those AI agents actually work as an organization as well, as much as we all the human work. But then the only difference is the AI agents organization, when they work through, they have their own approvals and all that. They do that. But at the end of the day, there's one human that is sitting at the gate and say, yes, this is my final approval. That's where we did not cross the
Mm.
line, and we keep that with us.
Fascinating. I mean, like we spoke about at the beginning of this podcast, you started your career in data. You bootstrapped the company, really built a lot of the code and software, and it shows till this day, and everything that you've built and have told us to this point.
Yep.
And so, on this point of like technology and upgrading your technology and building smarter, better technology for those, home care agencies out there, home health organizations, DDD groups, HPCS, etc., that are interested in upgrading their technology or are frustrated with the current process that they're facing, what's the best way to engage with you and your team at myEZcare online?
Oh, it's very simple. Our website is myEZcare.com, and they can go on that website and they can schedule a meeting with us, or there's a phone number that they can actually call in, and somebody will take on the information, and one of our subject matter expert will get on a call with them. And even I do that myself also a lot of times as well. I love doing that. Every now and then I also do that. And we will understand. One of the things that we do is we do not sell our package. We first understand what your requirements are. What do you want? How do you operate? And then we actually provide the solution. The difference is basically between the others and us is when we provide a solution, we provide a custom tailored solution for your business, which is not a canned
Mm,
system or software that we are actually offering you, because we our system has that capability, and we know about
yeah,
each and every state, their Medicaid and all that. A lot of startups do actually come to us, and when they actually sign up with us, we actually help them guide through on how to grow, and we actually provide them a lot of advices and consulting to on how to actually establish and grow from where they are at. Because collectively, if I look at it with the subject matter expertise in our company, we have got 150 plus years of collective experience between all the employees. So
I
we
believe it.
actually do bring
Yeah,
the value. And one last part is basically
yeah,
how are we different is basically our support system. When we actually you sign up with us, we never charge you for initial support or anything, but at the same time, we do not cut corners on the support. We will get on to with you for the problem, and we will not leave unless until the problem is resolved actually. And every client of ours think of us as basically their back end engineering or technology partners who are standing by with them all the time. I tell you like a simple scenario, like one of our clients actually had their claims being denied for certain reasons, and they have a backlog of claim for over 4 months. And they came to us, and we did not leave them till we actually got every single claim being reimbursed, or if there's valid reason for denial, so be it. But we actually ensure that they get most out of that reimbursement, and we work with them. Other companies would have said, "Oh
yeah.
yeah, that's between you and your payer. What can we do?" But we actually went
Right,
ahead and actually
right.
did it. In Idaho, Blue Cross Blue Shield, we actually worked with them to make a change for the EVV, which in their billing system was not catering to. We got on a call with them and actually did that. So this is
Yeah,
the need.
I mean,
This is
that's
what
a
we want. Yeah, we go above and
right,
beyond.
right. Focus on the need and the requirement of the customer and their business, and I love that, mantra of like, we don't sell, we provide a solution that's, we understand what your requirements are, and then we provide a solution that's custom and tailored to those requirements in your business, because there's a
Exactly.
lot of companies I see in this home care space that they're pushing a software, a solution, but you guys, it sounds like you've done that. Yeah, like you can provide that, but it's really more than that. It's like you guys are the technology engineering partners, and it shows in all the use cases and stories you've shared with us today. So with that said,
Absolutely.
Paul, I've really enjoyed our conversation today. I 100% will, follow your journey at myEZcare. I'm sure a couple years from now, the AI that you've built into your stack will be even more advanced, and excited to see more stories that come out of your work. And thanks for making some time to talk with me today and share all the good work you guys are doing on myEZcare.
Yeah, thank you. Thank you for having me and giving me an opportunity to tell all this. I get really excited about all these things, but thank you for having me.
It shows. And it shows. Yeah, absolutely. And thanks for your time.
Okay, thank you. You have a great rest of the day.
You too. Take care.